Meanwhile, fewer COVID-19 cases could mean fewer restrictions soon. President Cyril Ramaphosa met with the National Coronavirus Command Council and the President's Coordinating Council yesterday. Those sorts of meetings usually precede him addressing the nation. Now, it's widely expected that South Africa will move from lockdown level 3 to lockdown level 2, which will mean more numbers allowed at gatherings, less restrictions on the sale of alcohol, amongst other things. New cases have been on a steady decline, while many more adults have been vaccinated against COVID-19 in South Africa. To discuss, we're joined by the Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal, Professor Mosa Moshabela. Professor, great to have you with us as always. According to the latest one-day stats, there were just over 4,000 new cases, so that's way off, I think, around 20,000 cases at the peak. So in your mind, is this the right time to move down a level or two?
Good afternoon, and Francis and the viewers. I think that we are certainly seeing improvement in the trends of the cases and the epidemic curve that we've been monitoring from the third wave, and we are seeing a continuous trend coming down. Currently, the average number of cases per week is about 7,400. And as you correctly said, it has come down from the peak of about 20,000. So we're very grateful to see that. We are also beginning to see a continuous trend in terms of mortality. And so I would say that these are positive signs, Francis, but my view is that 7,500 per day currently is still quite high. Yeah. And you know, there could be an argument, in my view, looking just at the data, to delay the loosening of restrictions. And so this, of course, have to be balanced with other interests. I'm of the view that there is no public pressure to reduce, to come from level 3 to level 2, as opposed to when we were in level 4. There was a lot of pressure to move from level 4 to level 3. But currently, I don't get a sense that we do. The only thing really that I notice is that there's a lot of pressure from an electioneering point of view.
Yeah, because of the campaigning, and of course the gatherings will be huge there. But it won't really help if government moves from 50 people indoors to 100, maybe 250 outdoors. Are you worried about what the campaigning could mean?
Yeah, I think from a public health perspective, I am worried. We are looking for a breather at the moment. We're looking for a break from the sort of burden of cases that we have had. And what we are now going to face is a situation where the campaigning itself means that there's going to be a lot of gatherings. And we're going to see them in many areas. I mean, even on campuses, we are going to see a lot of campaigning as well. And this means then that there will be a lot of indoor activity, and if the numbers go up, you know, we know that the variant that we're dealing with is very efficient as in terms of airborne transmission, and because of that, when people are gathered indoor, it will spread efficiently. So I do hope that whoever is making these decisions, they are considering the unique situation that we are in and the fact that it's still very fragile. In as much as I see the political mandate to campaign and to get people to register and to get people to vote. But I do think that it is a very fragile situation we have to approach very carefully.
Professor, do you think there is a scope to relax some restrictions and still keep people safe? And are we doing this in the cleverest way? I remember arguments that the alcohol ban, for example, doesn't really work unless it's a total ban. So if we move from Mondays to Thursdays and then open up Fridays, say, that's one of the predictions, are we tinkering, or are these restrictions having real tangible benefits? Do we really know?
Yeah, I think the issue is that we see them from a public health point of view, we see them as a combination interventions. It's not really one intervention. It's a combination of the interventions that give you the maximum benefit. So people might say that an alcohol ban itself might be a problem, but if alcohol is a precipitator for gatherings whereby people are not following precautions, then yes, it may not be the alcohol itself, but it may be more the gathering. The issue is that alcohol creates conditions for that. Same thing with curfew, for example. So we have a problem in South Africa at the moment. There's data that came out early this week from Ask Africa and GCIS and Solidarity Fund that's showing that only 70% of South Africans are willing to wear masks every time they go out into the public. And once people are vaccinated, it looks like about 15%, understand that they have to consistently wear their masks. For me, that data was very concerning in terms of relaxation of restrictions. And it suggests that we are going to face a problem whereby any loosening of restrictions means that there is increased susceptibility for people. So I would say that we are going to enter into a very difficult position now if we are going to loosen restrictions further.
Yeah, especially with elections happening 1st of November. Let's look at other things. It's been reported that the government is considering using incentives to encourage vaccinations, and that's been done overseas in the US, for example. Sometimes it seems to add to the skepticism. Why is government paying me to get a vaccine? Who's behind this? But do you think it could be beneficial?
Yeah, it's a difficult question. I think, clearly government is desperate to get people vaccinated so that we can increase the proportion of people who are vaccinated and get back some degree of normality so that the economy can kick back. So I understand that argument, but I think that there's a need to understand the people who are on the fence about vaccination and tailor our approaches to their needs, instead of using blanket approaches like we see in other places. Of course, incentives will work for certain people, whatever kind of incentives. Restrictions will work for certain people. But mandatory vaccination in general, it also means that we are quickly resolving to a lot more nudging in our approach to vaccination. And what we are seeing in South Africa, the data that we have, the evidence that we have so far suggests that there's a need for a lot more empathy in the way that we approach vaccination and encouragement for people to vaccinate. The extent to which government is going to accommodate those softer approaches, for me, is where the question is. Yes, you may come with incentives, stadiums, restrictions, and all of that, and they will contribute something. But really, what about the thing that the people really need to have an empathetic approach to negotiating vaccination with them, addressing their concerns? How are we dealing with that? For me, is where I'm seeing a gap.
All right, thank you very much. Professor Mosa Moshabela, Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal.